Hello and welcome. This will be a patient education video about hypothyroidism. Some of the objectives for today's presentation will be learning about what is hypothyroidism, what are some causes of hypothyroidism, why do we need to treat hypothyroidism, how do we measure how your thyroid is working, how do we treat hypothyroidism, how should you take thyroid medication, and lastly, learning about some of the interactions between levothyroxine, which is a thyroid medication, food, other medications, and supplements with this medication. So what is hypothyroidism? This long word is easier to understand if we break it down. Breaking it into three parts, we get hypo, thyroid, and ism. Starting with thyroid, we learn that this condition affects this particular part of the body. The thyroid is a butterfly-shaped gland in your neck. At the beginning of the word, we see the word hypo, which is a term we put at the beginning of a medical condition to describe something that is less active. Think the opposite of hyper. It is easiest to remember this because hypo kind of sounds like hippo, which is usually a slow, less active animal you see at the zoo sometimes. Lastly, ism is just something we put at the end of some medical terms to describe a condition. So putting this all together, we have a medical condition that involves your thyroid being less active. Hypothyroidism. So what does your thyroid do exactly? The thyroid, like we said, is a butterfly-shaped gland in your neck that makes thyroid hormones for the rest of the body. You'll hear these described in this video as T3 and T4. Thyroid hormone is essentially a chemical message that affects other parts of the body and has a role in controlling your metabolism, how quickly your body is using energy, your heart rate, body temperature, your hair and skin, digestion, and even cholesterol. As we can see in the image over here, other than what I've described before, there's many other parts of the body that are also affected. Your eyes, your lungs with the breathing rate, your liver, and even your heart, as we'll see in later slides. So how does your body exactly know when to make thyroid hormone and when to stop making thyroid hormone? And how does this go wrong to cause hypothyroidism? As you'll see, there are three main players in this particular problem. In the top left picture you'll see is the brain, and inside your brain is part that's called the pituitary gland. And this particular gland, in this case, will start the chain of events that I'm going to describe now. When the pituitary gland detects that your body needs more thyroid hormone, it's almost like it's texting another part of your body, in this case with hormones, to kind of signal that it needs to work more. So in this case, your pituitary gland detects that you need more thyroid hormone, and it's going to essentially send a message to your thyroid gland in your neck. And the way it's going to send this particular message is through the hormone TSH. TSH stands for thyroid stimulating hormone, basically telling your thyroid to work more. So in this picture, the pituitary gland says, hey, thyroid, we need more thyroid hormone. And it will send TSH to the thyroid to get it to start working. Once received, thyroid gland will say, hey, I'm making it now and getting ready to send it to the rest of your body. So once the thyroid hormone is made, it's released as T3 and T4, as I described before. And once released, it will go to other parts of the body to have effects again, like I said, on the eyes, the lungs, digestion, your hair, your skin, and many other parts of the body. Once your body's had enough of this hormone, or once the levels of T3 and T4 get too high, they actually circle back and tell your pituitary gland to stop making the hormone. So in this case, your body's saying, thank you, I have more than enough now. I don't need any more. So T3 and T4 tell the pituitary gland to stop making TSH and stopping the production of T3 and T4. So what is hypothyroidism? Let's circle back to our definition of the condition. It's a thyroid that is not producing enough thyroid hormone, essentially low levels of T3 and T4, the product that your thyroid makes. The pituitary gland continues to detect that there are low levels of T3 and T4 in the blood and keeps trying to tell your thyroid to make more of the hormone. But unfortunately, because of various reasons, your thyroid is unable to answer that request. So essentially, in hypothyroidism, you see a high level of TSH, essentially the pituitary gland continuing to try to tell your thyroid to make more hormone, along with low levels of T3 and T4, which your thyroid is unable to produce. To the left here on this slide, I have a picture just with common levels of these hormones that your doctor can expect to compare your blood work to try to diagnose hypothyroidism. Nothing you need to remember, but it is a science where the doctor can diagnose based on your blood work and compare what your levels are to standard values that they would expect to see in people. So what are some of the causes of hypothyroidism? In the chart to the right here, I've listed some of the most common causes. First one is physical trauma, whether it's a surgery to remove the thyroid, an infection, certain medications can damage the thyroid, family history, essentially genetics, poor diet, radiation treatments, and also autoimmune diseases, essentially where the immune system attacks the thyroid, damaging it over time. Expanding upon these causes of hypothyroidism, family history is essentially something that's caused by genetics. If you've had a family member in the past that's had thyroid issues in their life, it's possible through genetics that you are at an increased risk of developing hypothyroidism as well. Poor diet contributes to having hypothyroidism because iodine, which is something you get from your diet, is something that's used to make thyroid hormone in the body. So what are good sources of iodine in diet? Fish products, dairy products, iodized salt. Diets lacking in these increase your chances of having hypothyroidism. Surgeries, sometimes a sudden trauma to the body, or having to get the thyroid removed, essentially removes your ability to make thyroid hormone or can damage that delicate gland in the body, causing the need to treat this condition. Lastly, radiation can damage the thyroid. And one example of this that you may know, if you've ever had x-rays taken at the dentist, they have you wear that big heavy vest to kind of cover your chest and your throat. That part that's covering your throat is to protect your thyroid from any kind of radiation damage. It's a very low amount of radiation and it's an abundance of precaution when you get an x-ray, but it is something that we do to try to protect the thyroid. As you can see in the bottom right on this slide, as I said that there's iodine on thyroid hormone, these are the chemical structures of T3 and T4. Nothing you need to know, just an interesting fact, but as you can see, on various points of this molecule, you'll see the letter I. That is iodine that is placed on these hormones that, again, you source from your diet to kind of create these hormones in your body. So lacking in iodine increases your chances of not being able to make thyroid hormone properly. Why do we need to treat hypothyroidism? Well, some of the symptoms are not very enjoyable. Some of these symptoms are you become more sensitive to the cold, you feel tired, you can get constipated, have dry skin, gain weight, have brittle hair and fingernails, hair loss, slowed heart rate, feel depressed, have memory problems, and also develop cholesterol troubles as well. So as you can see here to our individual on the right, he's not feeling too well right now and needs to treat his hypothyroidism. In addition to some of the symptoms listed before, there's also more serious issues with hypothyroidism. Most notably are cardiovascular problems. As I said before, cholesterol issues occur with hypothyroidism, and the bad cholesterol, which is also called LDL by your doctor, increases. This leads to issues for your blood vessels and your heart, and essentially can increase your chances of getting heart disease, increase your risk of stroke, and other problems as well. You may have seen this before, but another issue that occurs with hypothyroidism is when the thyroid gland becomes enlarged. This is also called a goiter by your doctor. This is an enlargement of the thyroid gland as it continues to try to produce more T3 and T4 that your body is requesting. Reasons this happens, can be because of iodine deficiency, autoimmune diseases like Graves' disease and Hashimoto's disease that cause an inflammation of the gland, and also cancer. Sometimes you can develop a tumor in the thyroid gland that can also cause enlargement as well. But as you can see in the picture to the left, the thyroid on the neck there is much larger and expanded because of the underlying condition going on in this patient to the left. How do we measure how your thyroid is working? Well, physical symptoms are noted, as you've listed before, and they are something you will notice. But a diagnosis of hypothyroidism is made with the addition of blood work. Blood work is the gold standard to determine the diagnosis of hypothyroidism. Your doctor can measure the levels of all these hormones in the blood and compare them to what they should be to get your diagnosis. Some of the things that will be measured in the blood work are, again, TSH, the signal telling your thyroid to work, which if is higher can signal that it's hypothyroidism going on, as well as T3 and T4, which if are low will also signal that the thyroid is not producing what it should be. Additionally, thyroid antibodies can be detected in the blood, and if these are detected, could signal that there is some kind of autoimmune condition going on, essentially where the immune system is harming the thyroid. And again, to the right here is our little chart that doctors will look at and compare what your blood work looks like compared to what it should look like. A low level of TSH, a high level of TSH, as well as low levels of T3 and T4 will signal hypothyroidism. Treating hypothyroidism is actually quite simple. It's just supplementing what your thyroid gland isn't producing enough of. So it's essentially like taking a vitamin each day to supplement your thyroid hormone. The most common thyroid hormone, which is a prescription medication, is called levothyroxine. This goes by the brand name of Synthroid. It's a synthetic T4 hormone that you can take each day to supplement what your body isn't producing enough of. Levothyroxine is the most commonly used medication and is highly effective at supplementing what your body needs. There are other thyroid hormone types which your doctor may try as well, but levothyroxine is the most common and most effective that a majority of people take.
Your doctor has prescribed levothyroxine to manage your underactive thyroid. These medications are effective in controlling your symptoms, providing you use them correctly. So you'll need to know how and when you should take your levothyroxine, how long will you need to take your medication for, and are there any potential side effects you need to look out for. This week we'll be answering the most frequently asked questions about your medication. My name is Dr. Hart Pinto, and in this series we aim to answer the important questions about your medications. At JHP Medical we make weekly information videos, so if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. So what is levothyroxine? Levothyroxine is a medication used to treat hypothyroidism, more commonly known as underactive thyroid. In this condition, individuals produce inadequate amounts of the hormone thyroxine. Levothyroxine therefore acts to replace this missing hormone. Levothyroxine is not available over the counter and can only be obtained via prescription from your doctor. A variety of medicinal preparations such as tablets and liquids are available, and this medication is safe to use in pregnancy and breastfeeding mothers. Amongst hypothyroid children, smaller doses guided by a paediatrician can be used. Who should not take levothyroxine? You should avoid taking this medication if you've had a previous allergic reaction to this type of medication, you have an overactive thyroid where your thyroid already produces too much thyroid hormone, and patients with conditions of the adrenal glands. Importantly, levothyroxine is not a suitable weight loss treatment. If abused, this medication can have serious and even life-threatening consequences. If you're seeking support with weight loss, please consult with your regular family doctor. Is it safe to take levothyroxine with my current medications? Certain medications should not be taken at the same time as your levothyroxine. You should take the following medications at least 4 hours after taking your levothyroxine, including calcium salts, iron supplements, cholesterol-lowering medications such as cholestyramine, colestipol, cholesevolem, sulcrophate, antacids, and orlistat. Additionally, some prescribed medications may influence the effectiveness of your levothyroxine. In some cases, increased doses of levothyroxine are required. These medications include anti-epileptic medications, estrogen supplements such as the oral contraceptive pills, rifampicin, and amiodarone. Levothyroxine itself can influence how other drugs work. Therefore, you may require dose adjustments if you're taking medications to control your diabetes, or you're taking blood thinning medications including warfarin. What is the correct dose of levothyroxine? Newly diagnosed patients start with a small dose of levothyroxine, which is increased slowly to achieve the desired effect. This dose is determined by your doctor, but most commonly you're started between 50 and 100 micrograms once a day. Usually, 3 months after starting your medications, you'll require a repeat blood test to assess your hormone levels. Based on this, your doctor may increase or decrease your dose. You may require several blood tests and dose adjustments to get the correct dosage for you. Once your thyroid hormone levels are stable, you'll only need them monitoring on an annual basis. How long does the medication take to work? Your medication will start working straight away. However, it may take some time for you to notice an improvement in your symptoms. How to take levothyroxine? Take your levothyroxine once daily, normally in the morning on an empty stomach. Aim to take your medication on its own with a full glass of water at least 1 hour before food or other morning medications. Capsules should be taken whole. It is not advisable to crush them, and if you have trouble swallowing your tablets, consult with your prescribing doctor or pharmacist about liquid preparations. Are there any foods I should avoid? Some foods and drinks can influence how well your levothyroxine works, particularly grapefruit, calcium-rich foods such as milk, cheese and yogurt, soy, walnuts and cottonseed meal, and any foods high in dietary fibre. Additionally, kelp contains the chemical iodine, which can worsen your symptoms of hypothyroidism. What about alcohol? It's perfectly safe to take alcohol with levothyroxine. I've missed my dose, what should I do? If you forget to take your medication, please take it as soon as you remember. However, if it's near the time of your next dose, skip the missed dose. You should be okay to take your next dose at the regular time. Do not take a double dose to make up for a missed one. I've accidentally taken too much medication. If you've taken too much of this medication, you should speak with an emergency doctor. Overdose of this levothyroxine can cause symptoms of chest pain, palpitations or shortness of breath, agitation, confusion, shaking and excessive sweating, loss of consciousness and even seizures. How long will I need to take my medication? Hypothyroidism is a lifelong condition, therefore individuals with this condition will need to take levothyroxine for life. Stopping your medication of course will mean return of your hypothyroid symptoms. Are there any side effects? The vast majority of those taking levothyroxine will not experience any side effects. However, the more frequently reported side effects are nausea, vomiting and diarrhea, headaches, flushing of skin, agitation and insomnia, muscle cramps, tremors and increased sweating. Sometimes rare or concerning side effects can occur. If they do, please seek urgent medical assessment. These include chest pains, palpitations or any allergic reactions, particularly anaphylaxis. Of course, this is not an exhaustive list. For further information, please see the drug information leaflet that comes with your medication. I hope this video has supplied the answers you were looking for. Don't forget to subscribe and interact by giving us a thumbs up or leaving a comment down below. This supports the growth of our channel and helps educate many more people about their medical conditions. Of course, this video does not provide individual medical advice and is intended for information purposes only. Do not consider this as a substitute for professional medical advice, diagnosis or treatment. Please do not ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. We'll see you next time. Bye-bye.
So let's review some of the key points from the video before. How much levothyroxine you may need, dosed by your doctor, is determined by your blood work, which your doctor will order at set times. Dosing is very specific. There are many strengths of the medication available to give you the perfect fit you need to feel fully back to normal. And as you can see in the chart below here are all the different strengths of levothyroxine, ranging from 25 micrograms, which is a really small amount, all the way up to 200 micrograms, 300 micrograms. And there's very small intervals between each of these strengths as well. You'll see 100 micrograms to 112 micrograms. Very specific stuff just to make sure you're getting exactly what you need. A custom fit, per se. Really, the only reason someone should take levothyroxine is if they don't have enough thyroid hormone, just to supplement what your body doesn't have. So people that shouldn't take levothyroxine are those with a normal thyroid, those with an overactive thyroid, which is another condition we may talk about in another video, people interested in losing weight. Levothyroxine has effects on weight loss, but should not be used as a weight loss medication. And additionally, if you are any of these patients listed above, too much levothyroxine is also a bad thing. People that take too much levothyroxine may experience heart palpitations, confusion, lightheadedness, loss of consciousness when it gets really serious, and even insomnia or lack of sleep. How to take thyroid hormone is very important. Thyroid medication is best taken with water first thing in the morning, 60 minutes before food or other medicines or supplements. This is because thyroid hormone interacts with a lot of things, which prevent it from being absorbed and getting to where it needs to get. If you're not taking the medication first thing in the morning, you'd like to try to space it out by at least 4 hours after a meal or other medications that you've taken. Again, otherwise, if you're not doing this, you're not going to absorb the medication like you should be and either require higher doses or just not get enough and not feel better. There are some foods that you need to watch out for around your thyroid medication as well. Calcium-rich foods often reduce the levels of levothyroxine that get into your body. So foods like milk, cheese, and yogurt, you definitely want to avoid eating or drinking around the time that you're taking your medication. Drinks with caffeine also reduce the amount of levothyroxine that get into your body. Things like coffee, tea, even energy drinks that you don't think of, like the Prime drink listed to the right there. Kelp is also something that's rich in iodine. If you're supplementing with levothyroxine, you might not need as much iodine as you get from the kelp food listed below. Grapefruit juice also has minor effects on lowering your body's ability to absorb levothyroxine in the digestive tract. There also are significant interactions that occur between levothyroxine and other prescription medications you may be taking. There are anti-epileptic medications like carbamazepine that may change the dose of levothyroxine you may need. Certain estrogens, like birth control medications, may require higher doses of levothyroxine because your body isn't able to absorb as much. Amiodarone can also cause levothyroxine concentrations to either increase or decrease in the body, requiring a dose change. Also, other medications may be affected by the presence of levothyroxine themselves. Diabetes medications may need their doses adjusted due to the way thyroid hormone has effects on your metabolism and can cause changes in blood sugar concentrations. Warfarin as well, which is a blood thinner, may need its dose decreased when levothyroxine is started as well. All things that your doctor monitors and changes based on what they're seeing. Interactions with over-the-counter medications are also very significant for levothyroxine. These are medications or supplements that your doctor may not be aware that you're taking as well, so it's important to tell them that you take these. Iron supplements, antacids, and calcium supplements all have charged particles within them that interact with levothyroxine, binding them and preventing it from being absorbed within the body. Other stomach medications are also available over the counter, one of which is Prilosec, generically called omeprazole. This medication decreases stomach acid, which is essential for trying to absorb levothyroxine. So again, you'll see some pictures of these supplements and medications under here. These are stuff that you can see in the pharmacy or in the supermarket to kind of help treat, whether it's acid reflux or supplement your low iron. These are all things you should tell your doctor about that you're taking because they do interact with levothyroxine. Why is it important to always take your thyroid medicine? In hypothyroidism, your thyroid continuously isn't producing enough T3 and T4, so there's always a need to supplement what your body is no longer making enough of. So trying to remember when to take your thyroid medication and to take it each day are both very important factors. There are aids nowadays to try to help to remember when to take your thyroid medicine, and you can see some of them pictured to the right here. The far right picture is a pill organizer, which you could fill with your daily medications and kind of remind yourself when to take them each day. Another cool example is the picture to the left, which is what's called a timer cap. It's essentially a clock that starts ticking once you close your medication vial. If you see 24 hours have passed on that little clock on the top there, you'll know that it's been 24 hours since you last opened it and the last time that you took your medicine. So it could be a good reminder to know, hey, did I take my medication or not today? And look at that little timer to see the last time you opened your medication vial. Additionally, nowadays phones are more popular than ever, so using alarms on the phone also help remind yourself when to take your medication. Even with all these aids and reminders, we're all human and may forget to take our medication. But what if you forget to take a dose of your thyroid medication? Well, thyroid hormone isn't removed from the body very quickly, so you may not immediately feel the effects of a missed dose. Half-life elimination, which is the amount of time it takes your body to remove half of the drug, is about 9 to 10 days in hypothyroid patients, which is a long time. So if a day is missed, it's not something where you need to catch up essentially and take double the dose of your medication to try to catch up and get your day's dose in. You don't want to ever double up on your medication. Simply skip the day and start up like normal the very next day. Let's do some review questions to go over what we've discussed today. Question 1. What is hypothyroidism? I'll give you a few seconds to think about that. The answer is a condition in which your thyroid hormone isn't producing enough hormone. What are some causes of hypothyroidism? Some of them include a family history or genetics, physical trauma to the thyroid, poor diet, diet that's lacking iodine, radiation damage, autoimmune disease. Why do we need to treat hypothyroidism? Think back to how the patient was feeling and some of the more serious side effects from not treating hypothyroidism. This is to essentially help patients feel better. People with hypothyroidism feel tired, sensitive to cold, gain weight, have dry skin, brittle hair and nails, and have serious consequences like heart disease, increased risk of stroke, and many more things. How do we measure how your thyroid is working? Again, your doctor wants to know how you're thinking or how you're feeling, but blood work is the gold standard to determining if you have hypothyroidism. Your doctor will have labs that measure your thyroid stimulating hormone, or TSH, as well as the T3 and T4 hormones themselves. Additionally, if your doctor is trying to determine what's the cause of your hypothyroidism, they may try to detect antibodies in your blood to see if it's an autoimmune disease that's causing the issue. How do we treat hypothyroidism? It's the most common medication. It's kind of like taking a vitamin each day to supplement your thyroid hormone, but the name we're thinking of is, yes, levothyroxine, also called Synthroid. It's the most common medication used to treat this condition, and it's very effective, very specific as well in its dosing. How should you take levothyroxine? Again, think back to how we told you to take it, spacing it out from other things, other foods and medications and supplements. That's correct. First thing in the morning, 1 hour before any other food or other medications or supplements, with just plain water each day. What are some interactions between levothyroxine and food or other supplements? Think back to some of the foods you may eat in the morning. Think back to some of the products you may see in the grocery store or in the pharmacy that you don't necessarily need a prescription for. So to review food, we think dairy products like milk, cheese, yogurt, kelp, grapefruit juice. Supplements like antacids or Tums, iron supplements, calcium supplements, all of these have the charged particles that prevent levothyroxine from being absorbed. Thank you for watching this presentation and have a very good rest of your day.